This episode of Healing Together is brought to you by Let's Get Checked, the leading provider of at-home health tests. Ladies, did you know that hormone imbalance symptoms can range from insomnia, weight gain, or feeling tired all the time, to breast tenderness, skin rashes, or changes in blood pressure? Female hormone function is important for a number of different situations, including polycystic ovary syndrome, ovarian failure, low ovarian reserve, early menopause, thyroid issues, and ovulation function. With Let's Get Checked, you can do a simple at-home test that will give you a complete picture of your hormonal health in 5 days. How does the process work? Let's Get Checked delivers a test straight to your door. You just self-collect a blood sample from the tip of your finger and mail the sample back to their accredited laboratories with a prepaid label. You'll receive support and guidance from the Let's Get Checked medical team, who are available 24/7 to offer you personalized advice. This week, Let's Get Checked is inviting you to try an at-home test for 30% off with the discount code TOGETHER30. Go to letsgetchecked.com and enter TOGETHER30, TOGETHER30, and let's get checked.
Welcome to Healing Together. I'm Nicholas Boileau. Today I'm talking with Cindy Tenner, who was diagnosed with Hodgkin's lymphoma at age 19 and many years later continues to manage chronic health issues resulting from the very treatment that saved her life. We talk about her health journey and what it's like to live in a pandemic given very high vulnerability. We address managing expectations for health and life and Cindy's way of maintaining a rich social and family life with her husband, children, and grandchild. Cindy combines the best qualities of reasonableness with a fighter's spirit and left me inspired to make the most of today while keeping myself in as good a shape as possible for whatever might come tomorrow. So without further delay, here's Cindy Tenner. I'm here with Cindy Tenner. Welcome to the podcast.
Thanks, Nicholas.
How about we start with a brief introduction of you and your medical history so we can get a sense of what you're living with?
Okay. I am a 60-year-old woman who was diagnosed in my sophomore year of college at age 19 with Hodgkin's lymphoma. It kind of popped up out of nowhere. I was studying for midterms, woke up with a swollen neck one morning, thought I had swollen glands, went to the infirmary, who then referred me to the local hospital, who wanted to do a biopsy. I then left school to go to a bigger medical center and was diagnosed. That was 1978. I was treated with a staging surgical procedure and large doses of radiation. That was state of the art at the time. I was told I was very lucky because had I had Hodgkin's lymphoma 10 or 15 years earlier, the likelihood of survival would have been much lower. And so I was treated daily with radiation over the course of about 3.5 months after I'd recovered from the surgery. Then I returned to college and went on about my life pretty uneventfully on the medical front until I was about 40. At 40, I started experiencing some shortness of breath, some other mysterious symptoms that then, after visiting many doctors, were diagnosed as late-stage side effects of the radiation damage. So the treatment that saved my life led to more health problems. But I just want to start out initially with saying I was treated with state of the art at the time. It allowed me to live. So I take the health challenges as a positive thing and keep on living.
Wow. Well, what a story. And I'm just curious, when you were 19, how long was it between the moment you woke up with a inflamed neck and when you found out that you had this disease?
It was about a week and a half. Things moved very quickly. I think I am fortunate in that sense that my parents were both involved in the medical profession. So once they heard the words biopsy, they took me to a major medical center, and I was evaluated and diagnosed very quickly.
And now it sounds like around age 40, you really started being aware of some of the long-term effects of your treatment.
Exactly. Around that point, I started having issues and nodules with my thyroid. It wasn't functioning due to radiation damage. I had a thyroidectomy. I had a very brief, like a 10-second loss of vision, which was diagnosed as a transischemic attack, which led to the diagnosis that my carotid arteries were very scarred from radiation. And then the big challenge was this worsening of the shortness of breath, which got quite severe and actually ended up in me having a coronary artery bypass, a triple bypass, in a pretty emergent situation.
What was the diagnosis at that point?
That my left main coronary artery was 90% blocked, and that my heart was very scarred from radiation. And the blockage was it was different than a cholesterol type buildup. It was more of a soft scarring rather than the plaque term that we hear with cholesterol buildup.
So you had the bypass surgery, and then did you have more issues after that, or was it pretty much over for a while?
It's been a constant management, I would say, for the past 20 years. I have had 2 secondary cancers, again, caused by the large doses of radiation I had in 1978. One was breast cancer, one was a melanoma, both in the radiation field, if you will. And then after the heart surgery, I worked my way back, to some level of fitness through cardiac rehab and things like that. But within about 5 to 8 years after that, the shortness of breath was becoming more of an issue. And it wasn't due to more artery blockages, but rather what's called diastolic heart failure. And with diastolic heart failure, it means my heart still has good pumping ability, but because it's stiff due to the scarring, it doesn't relax well between beats, which causes some fluid buildup, which contributes to shortness of breath. I also have some scarring in my lungs from the radiation. So it's been a constant management of breathing issues, if you will, particularly with exertion.
And breathing is something most of us take for granted. I can imagine it's a real stress on your whole life to know that at any moment or given any number of activities, you can have trouble breathing, which is so essential to being alive.
It takes a lot of planning on my part and a lot of things that I do to try to take care of myself. The planning includes things like, where am I going to park the car if I go to a certain place? And if I have to park far away, I need to allow a longer time than the average person would to then walk to my destination, because I'll have to stop and take some breaks. So it takes planning, but I try to keep my life as normal as possible by building in the planning and other things that I need to manage it.
Yeah, I want to pause and talk about that a little bit, if you don't mind. You've used the words with me, managing a chronic illness. Can you expand a little bit on what it means to manage a chronic illness? And like even what you just said about planning and thinking about where you're going to park. Those of us who don't live with a chronic illness really don't fully understand the number of areas that can affect in your life.
Sure. Just to sort of level set, when I refer to chronic health challenge for myself, I'm referring to the diastolic heart failure, which causes me the shortness of breath. And I have a rather unique situation that when I do overexert, rather than my blood pressure going up to compensate as it would in someone with a more normal heart, my blood pressure drops. So it also leads to faintness and fainting if I push too hard. So the shortness of breath and the possibility of fainting are the two main things that make me very careful about my planning so that I can stay safe and live my life. The ironic thing is that exercise is very good for my heart. So I am extremely disciplined about exercising every day, 7 days a week. Now, for me, exercising might be something that you would consider a short stroll, but I rely heavily on my Fitbit, which records my active minutes, and I try to make sure that I get at least 30 minutes of active time every day. So that's one of the things that helps me keep my heart as strong as possible. The other thing that is a more immediate impact is that I benefit from a low sodium diet. So salt makes you tend to retain fluid. Since I build up fluid anyway, I need to eat a very low sodium diet. Now, that takes planning because so many foods, particularly I think in the processed food lines that the American diet is big on, have so much sodium. So I plan my grocery shopping, I plan my meals, I plan if I'm going to eat in a restaurant, something obviously that hasn't happened during the pandemic, so that I can enjoy being out with the company of others, but not impact how I'm going to feel the next day. And one thing I like to differentiate is, in the long run, all of us who try and eat a healthy diet think, well, overall, maybe I don't want to eat too much red meat, or I want to eat fish 3 times a week. But if we slip up one week or another and yet are overall maintaining what we consider a healthy diet, we don't feel any repercussions. If I slip up and eat too much salt, I'm going to feel lousy, if not the next day, within 2 days, and it's going to impact my breathing quite substantially. So that's a big motivator for maintaining a low sodium diet, because I feel so much better.
Does the fluid drain by itself, or do you have to go get treatment?
I have oral medications that I take, diuretics that I take on an ongoing basis. There are events that occur, just sometimes you build up extra fluid for no particular reason, maybe a very humid day, stress, some other reason. A lot of times it's impossible to figure out. So I might check in with my doctor and take extra doses of diuretic. If someone has a severe fluid buildup, they would likely need to go to the hospital and have it drained through stronger medicines. That's something I try really hard to avoid.
Right. And if you get a little bit of fluid buildup, you can feel it right away as an impact on your breathing.
Yes.
You mentioned the pandemic, Cindy, and I want to go there because I know for someone with a chronic illness, the pandemic is even scarier than for the rest of us. Can you talk a little bit about how living in the pandemic compares to living before it for you?
So many things to look at there. First of all, at the beginning of the pandemic, I was one of probably the earliest people to start quarantining, stay in isolation in my home. I stopped going to the office before my office actually had everyone work from home. I'm high risk, so I had to take extra precautions. On the flip side, I became so focused on COVID that for a brief period, I stopped worrying about all the other little worries that I tend to worry about. So I've always been very cautious about food safety, things like salmonella poisoning from undercooked chicken or things like that. And all those things sort of went out of my mind, or the fear of getting the flu or a bad cold, which would be harder on me than someone else. I became very focused on COVID. So that was sort of a strange reaction to me, because that just became the one worry instead of thinking about all the other things. As time went on, I struggled with the social isolation that everyone else struggles with. I wondered whether all the medical appointments that were being canceled for me, I have a lot of routine follow-ups and checkups to just keep a monitor on how things are going. I wondered if that was going to have long-term impact. Would something be missed and get worse because I wasn't seeing the specialist every 6 months or whatever my schedule was supposed to be? Those were sort of the beginning and sort of short to midterm thoughts. Now that I feel like we're in this for the longer haul, at least someone like me who's high risk and is going to have to stay very cautious until there's a treatment or a vaccine, and just trying to live my life a little bit differently. I have gone back to the doctor. I've had some virtual appointments. I've gone in for some medical tests. I have felt very safe. I feel like all the appropriate precautions are being taken, but I'm not going to do something like go shopping or get on an airplane or even go on a big car trip and stay in a hotel in the immediate future. So I'm trying to just sort of figure out how to live my life, happily while staying safe.
How do you react to people saying illnesses will come and go and we should just open up and come what may, let's just deal with the consequences?
I understand why some people have that view, and I understand that there are tremendous pressures on the economy, childcare, everything else. So I don't think it's totally unreasonable. What I think is unique about this COVID-19 coronavirus is that there is so little known still about it. I think we're facing too many unknowns to kind of make sweeping statements about whose life is valuable, whose life might be sacrificed in order to get herd immunity. But I do know that, kids need to go back to school. People need to go back to work. So I think that everyone needs to work really hard to protect each other, and that we need to figure out the safest ways to make these happen. It's not going to be the same way we've done things as before. And I also realistically know that someone like myself who is high risk is going to perhaps have to miss out on some things that I would have done because I don't want to take the risk.
I feel it's morally offensive to be cavalier about some lives will be lost and let's just move on. Hearing from people who are high risk and who would be the ones who are quote unquote sacrificed is helpful to everyone to understand that, we're not just talking about numbers, we're talking about people. And there's a moral question there as well as an economic one.
I agree. I think that there's been a lot of rhetoric out about older people or elders or older adults. And I think that you cannot judge the value of someone's life ever by their age. Or I don't think it's fair to judge the value of anyone's life. But we do live in a society, so we have to figure out how we all help each other and do the best we can, is my philosophy.
Yeah, and I think when you look at our progress as a species, there are countless examples of people who have struggled with health, and because they were able to get good enough health care to continue to live, they've made immeasurable contributions to our culture and our scientific progress, our technology. So it's not only morally deficient to say, well, we'll sacrifice a few, especially in a country that's wealthy, but it's potentially a long-term harm to the very power that keeps us going and making progress as a society. Let's talk a little bit about travel, if you don't mind, because in previous conversations, you talked about how much you love to travel. And most of us are now starting to think about things we've never had to think about before. For instance, I think about, will there be a medical facility near where I'm going? What services will that medical facility have? How far will I be from home if I need to get back to quarantine? What would it be like to quarantine wherever I'm going? I'm wondering if for you, you're sort of thinking, well, welcome to my world now. On the other hand, are you thinking that perhaps the world is going to start to pay more attention to these things and ensure that fewer people travel when sick? Maybe that facilities and transportation are more properly disinfected, that medical facilities are more available. Like, could this pandemic actually cause it to feel safer while traveling? So that's really a two-part question. One is, are you having a little bit of welcome to my world? And are you also thinking that this might make traveling better over the long term?
I think I do have a little bit of welcome to my world. I will add the caveat that I am, by personality, a worrier and a planner. So I think even without the health challenges I face, anytime I travel, I try to be prepared for anything. I think that for many years, I have worried about traveling and having access to medical care since I have had, some emergency situations at home where I have needed medical care quickly. So that limits where I will travel. I will only travel to places where I know that I will have access to medical care, and I check in with my physician before I go, and oftentimes can get a name of a recommended doctor or at least a healthcare institution that would be recommended to go to for each location I'm in. I think this is particularly easier if you have physicians at a major medical center who perhaps through their academic work know people in different locations and things like that. But I think it's doable and reasonable to ask your physician, hey, I'm going here. Can you look up and see if you can find the name of someone that you would recommend I call if I had any problems? In terms of making travel safer, I think it has the potential with the extra disinfecting and things like that. The space issue, airplanes being crowded and things like that, I think that will take longer to remedy. But I also understand that the ventilation is much better than I ever thought in airplanes. So that seems to be less of a risk, according to some things I've read.
Yeah, although I'm still really suspicious of a crowded plane and, sitting in a row, 3 across, 2 feet in front of me and another 3 across, 2 feet behind me.
Oh, I agree. I wouldn't personally get on a plane right now.
You talked about asking your doctor for a recommendation. Can we just discuss the support system, the medical support system that you want to have if you're managing a chronic health issue or an illness? What's that like? How do you find the right doctor? Are there recommendations you can make for having that person who's actually willing to answer your call and talk about your travel plans, even if that doesn't involve a visit?
In looking for a physician, everyone has different criteria that are important to them. And I think some people feel better cared for at a community hospital because it's more personalized attention. Some people prefer the expertise of a large academic medical center. I don't think there's a right and wrong here. I think this is a case where each person has to decide what's important to them in their medical care. For me, it's very important to be cared for at a major medical center, which I'm very fortunate to have close by living in the Boston area. And it's important to have specialists that I can build a rapport with. And I have been very fortunate with that in most cases. And part of that becomes being able to talk to your physician about what's important to you and make sure that what they're trying to help you accomplish aligns well with what you're trying to do.
Can you dig into that a little bit for me? Like when you say what you're trying to accomplish, what do you mean? Like staying alive or the quality of life or the types of activities?
Well, I think it's a combination of that. As an example, about 3 years ago, I was hospitalized with extreme fluid buildup, and a pulmonologist was added to my group of specialists during that hospital visit. And in one of the first times he was in my hospital room talking with me, he asked me, "What do you expect?" I was caught off guard by that. And at first it made me angry. And my flip reaction was, I want to get better, get out of here and live my life. But as I thought about it, I needed to have realistic expectations within the severity of my chronic health issues. So at that point, I talked to him about what's really important in my life, spending time with my adult children, seeing them grow even more in their relationships and their careers. I wanted to be a grandmother and have a close relationship with grandchildren. Once I said that, he softened and I think understood that I wasn't asking him for some kind of miracle so that I could go run a marathon. I know that's not within my realm of possibilities. So I think it's a give and take between doctor and patient of what your expectations are, how you partner, because the patient has as much responsibility as the doctor of doing what benefits them so that you can get to a point of living a life you're content with without, being angry at the doctor because I can't go run a marathon. Does that make sense?
Yeah, it makes a lot of sense. And it sounds like that doctor, although his bedside manner may not have been the best in terms of the word choice, it sounds like he helped you level set for yourself and for him so that you could have a mutually understanding conversation about what comes next and how to make it happen.
Exactly. And I will say that I have built a great rapport with him, and he understands me. He's very straightforward about what's realistic and what's not. And it works. And I feel good about that.
That's great. Let's talk about the rest of your network, your support system. So I have a little bit of a bias, of course, because I built a company to bring people together who face similar health challenges. Can you talk about how you've developed a peer network and how helpful that's been for you?
Sure. The first thing I will tell you is, in a bit of irony, in 1993, when I moved to Massachusetts, I met a woman who had also moved into my neighborhood. We were the same age, had kids close in age, and were both stay-at-home moms at the time, and gradually became friends. And one day we started having a conversation after we'd become friendly that led to me saying something about my history of Hodgkin's disease. And she had the same diagnosis at almost the same time.
No kidding.
And it became a bond to this day. We became good friends anyway. I don't think you can necessarily become friends with someone just based on a shared chronic condition, though maybe that's possible. But we became good friends, and she lived in that neighborhood for 3 years before relocating back to the West Coast. And we've both gone through different challenges, yet similar due to our histories. And she has been just a great person to talk to because she gets it. She knows how I feel. I can tell you that I feel short of breath, and you can say that must be really hard, but she knows exactly what it feels like. So that's been an amazing friendship for me. The other thing that I will say is I have always tried to be very strong and tough and have been very private about my health challenges, really until recent years when it became impossible to hide them, because a friend would say, let's go for a walk. And I would finally have to say, I can't walk and talk at the same time. I can go with you and walk slowly if you want to talk to me, or if we can have a conversation, we should probably sit and have a cup of coffee. So I've had to tell more people as my condition worsened because I couldn't hide it anymore. And I think that's probably been healthier for me to be more open about it and not try and just be strong all the time. So I would say that my support has expanded to more friends that I have been willing to really share what it feels like with. And then the third component is one that I went at reluctantly, but has turned positive, and that is online support. And a few years ago, I joined a couple of Facebook groups, one for congestive heart failure, one for low sodium lifestyle. And I have to admit that I joined both initially as a voyeur, sort of. I was just curious. I did a lot of watching and reading. Thought I knew a lot about both and what could these people offer me. But amazingly, I have found really helpful things in both sites. On the low sodium group, it's been more about, hey, that's a great product. I never knew that those English muffins were low sodium. I can have those English muffins, or a great recipe idea. On the heart failure group, it's more about, does anybody ever get this feeling? It's so weird about, I really like ice cold water. And it's fun to just sort of share and say, yeah, I have that too. I wonder what that's about. With those groups, people can be there for all types of reasons. So it's harder to find your niche. There might be people on the low sodium group because of high blood pressure or because of Meniere's disease or all sorts of reasons. So sometimes it's harder to find that close relationship, but I still place a lot of value on those groups. What I'm seeing with Healthenly is you can narrow the focus to find the people who not only have the similar condition, but you can look to find that small group who shares your values about how you want to handle it, whether you want to use Eastern medicine or Western medicine or a combination of the two. And I think that you are providing a great service there, Nicholas, by helping people to come together to support each other.
Yeah, well, I appreciate that. And I think there's enormous comfort in the Facebook groups. I belong to several of them. And of course, we're trying to do something slightly different by allowing people to form those very small teams of like-minded people that can really be part of each other's health journeys and give each other advice and wisdom and coaching as they go through something. But I think both can coexist and both can offer a lot of comfort to patients and caregivers alike.
Absolutely. Actually, you mentioned caregivers, and I'd like to elaborate on that for a second, if I might. I'm referring to my husband, and it's hard for me to think of him as caregiver because I try to think of us as partners, but he does do a tremendous amount of caregiving, particularly on days when I'm not feeling as well as other days. He picks up the slack on whether it's cooking dinner or doing the dishes or whatever else so that I can rest or do what I need to do. And I think those of us with chronic illness have to have tremendous respect and gratitude for those who are there day in and day out to support us, whether it's a friend, whether it's a sibling, a spouse, whoever that person is. It is not easy on them. On a couple of occasions when my husband has had some illness, we have talked about, is it harder being the patient or the caregiver? And sometimes it's a real toss-up. It's a challenging role. And I think that one of the things that I try to think about is, what can I do to not make that role as hard for my husband? And sometimes that means that I need to not take risks that I might otherwise take, because if something goes wrong, it not only impacts me, it impacts him. So big shout out to caregivers.
For both people, the caregiver and the patient, it can be a very lonely experience. So you're very lucky to have a really wonderful caregiver living with you who's also your partner.
I am extremely lucky, and I do not take that for granted. And I think, that ties back into the whole pandemic thing. Particularly, I think for people living alone, it's more challenging to avoid the isolation, the social isolation. And that's where I think, particularly right now, things like the Facebook groups and the Your Health Only site, anything where you can have connection with people who are there, who understand you and support you, the value is so magnified now while we're staying closer to home.
And the loneliness is so amplified right now. You can see that in all the sites, certainly our platform, and certainly in Facebook groups I've been on. You can just see that people are really screaming for connection.
Exactly.
Let me move us to one more topic, if you don't mind, before we start to wind down. It strikes me that most people, certainly it's true for me, don't go through life thinking about death as a possibility in the near future. And now with COVID, we've all been forced to think about it a bit more. You're someone who's faced this possibility since being diagnosed with a deadly disease at a really young age. Are you able to give a little bit of perspective or advice about how to incorporate that reality into what might be an otherwise normal life? How do you live with that?
I can't say that I'm comfortable with death. I have not. I envy people who have sort of made peace with it. I feel like I have a lot more living I want to do. And I think that the way I have dealt with it is, I think of myself as a survivor. And that is why it's so important to me to do the things that I need to do to stay healthy. And at one point, a physician said to me when I was kind of getting out of control with what if this and what if that, said, you have to have good short-term outcomes to have good long-term outcomes. That's sort of been my mantra, that I try to face things in small chunks. Maybe it's one day at a time, maybe it's a little bit more than that, but I try to do what I need to do to stay healthy. As I mentioned, my exercise, my low sodium diet, enough rest, all those sorts of things. I try to do all those things in the short term so that in the long term, I have a better shot at things. And when I do hit a bump in the road with something worse or getting an illness, I try to stay very focused on tackling that and doing what I need to do to get better, because I'm not ready for death. I want to do a lot more living. That's why during COVID, it's important to me to take all the precautions I can, wear the mask, stay isolated, whatever I need to do, because I do believe we'll come out of this, whether we get effective treatments, whether we get a vaccine, whether we learn to adjust, so that I'm trying to, again, think of things in the short term and tackle them so that by virtue of doing these building blocks, I have the long term to continue living as long as I can.
I think you're giving us a lesson for all of life, not just for health and living in a time of COVID. It means so much to focus on the things you can do something about today. And I think we exacerbate our anxiety by often focusing on what we can't do anything about tomorrow.
You're right. And I will say I'm not perfect in managing that, but that's what I strive towards.
That's great. Do you still have time for a few rapid fire short answer questions?
Sure.
Okay. So this is just to satisfy my curiosity and hopefully the curiosity of listeners. Maybe start with the best health resources you can recommend online.
That's tricky because it's almost a hobby of mine to read a lot online about health topics. Whenever I just want to understand something, I find that the Mayo Clinic site has excellent explanations of illnesses, conditions, medical tests, things like that. I like that a lot. I also am a big follower of medical topics on Twitter. I will add a caveat there that most of medical Twitter is written by physicians for physicians, so it's often difficult to understand, but I've found people that I like to follow, and when I see something that I want is worth learning more about for my particular health, I will then try and find a resource that is more in layman's terms.
Great advice. And I agree. The Mayo Clinic is a fantastic place to learn in English you can understand.
Yeah, I think it's really well written.
What do you do to laugh?
What makes me laugh the most is playing with my 1-year-old granddaughter, because she is just so adventurous and fun. But I haven't been able to hold her since March 6th. I have had 3 outside socially distanced visits with her, and she still makes me laugh, and she makes me laugh on FaceTime. So that is number one. And, just sometimes just being silly with my husband. We will just both have something that strikes us as funny. So it's just a matter of bringing some silliness into the day.
Yeah, I agree. What gives you the most hope?
My family gives me hope because I think they're all so amazing. They're so supportive of me, looking out for me. So they give me hope. Medical professionals give me hope. I am more often than not in awe of their dedication to not just to their careers. I think most people who go into medicine have a real compassion for people that makes them keep going, that they're the ones who are helping to solve, whether it's cancer or the pandemic. So medical professionals give me a tremendous amount of hope.
And I think most of us go through life not really thinking about what a difficult job most of them have.
Exactly.
All right, last question. I tend to go deep in the woods when I need to completely escape, find a remote cabin and just stay there for a few days. I imagine when you're dealing with a chronic illness, that's the last thing you want to do is get really far away from civilization and the help you might find there. So what does Cindy Tenner do to escape?
My one guilty pleasure is junky TV shows. That's an escape for me.
Is there one you can recommend?
I like romantic comedies and anything that has a feel-good, happy ending. And also being near the water. I'm lucky to be able to spend a lot of time at a lake. And whether it's just floating in an inner tube or paddling around in a kayak, or sometimes even going fast on a jet ski, water is soothing to me.
Cindy, I can't thank you enough for spending the time.
I enjoyed it, Nicholas, and I hope that it's helpful to someone.
Likewise. Take care. Healing Together is produced by Healthily. Our theme song, Ramble, is composed and performed by Ed Morneau.